The Miami Peel and the Miami Peel S-30, which are part of the Quintessence Skin Science line, are two treatment modalities that I have had tremendous success with in my private practice. These two peels are both extremely effective and very well tolerated light to medium depth peels. They can be used on all skin types within the Fitzpatrick skin type scale. It is not necessary to peel an entire area. Depending on your goal, spot treatments are also an option. Typically, skin types 4, 5, and 6 are difficult to peel and often display hypo or hyperpigmentation or other post-peel skin-related problems. With these two peels, we have not seen these complications and our patients have been extremely satisfied with their results. These two peels are lipophilic, have antioxidant benefits, they are comedolatic, anti-inflammatory, and possess a skin lightening effect. They aid in the effects of photoaging by improving fine lines and wrinkles while also being very effective addition to the therapeutic arsenal for treatment of melasma and post-inflammatory hyperpigmentation, secondary to acne and other skin conditions. The Miami Peel is a layered peel and is left on the skin in order to potentiate its lightening effects. The Miami Peel S-30 is removed but requires no neutralization whatsoever. They are fast, safe, and effective for use on all ethnic skin types, including Asian, Hispanic, and other skin of color. For advanced practitioners, the Miami Peel and the Miami Peel S-30 can also be used in combination with one another in a layering technique as well as in combination with other procedures such as microdermabrasion and other resurfacing treatments. Before starting these or any other skincare protocols, have your patients fill out the provided medical peel intake questionnaire and pay attention for any physical or psychological concerns or issues before you begin your pre-peel process. Have them sign and take home the post-peel informational sheet along with any at-home post-peel information they require. Always be cautious with the patient who is being peeled for the first time or patients being treated with other skin sensitizing agents such as retinoids. Always remember that peels have a cumulative effect and are performed in a series with one peel performed every 10 to 14 days for about 6 to 8 sessions to gain maximum benefit. Let me introduce you to our medical esthetician, Beth Miller, who will guide you through these steps of these two peels.
Hello, my name is Beth Miller, and I'm a medical assistant and licensed medical esthetician. I'll be guiding you through the Quintessence Skin Science Miami Peel as well as the Miami Peel S-30 today. These two peels are distinctly different from one another in both their application and aftercare. The Miami Peel is a layered peel that's used for its lightening, balancing, and toning effects on the skin and is a very effective anti-aging wrinkle reduction treatment. The bleaching agents together will reduce the appearance of melasma, hyperpigmentation, and photoaging. Up to 5 coats of the Miami Peel may be placed onto the skin with a waiting time of approximately 3 minutes between each layer. The Miami Peel is also beneficial for those who suffer from acne and have oil-dry skin created by overwashing and overstripping the stratum corneum with excessive facial drying agents. Over-drying the skin will create unwanted flaking, milia, inflammation, and produce more oil as an epidermal protective measure. This peel is appropriate for most skin types. The Miami Peel S-30 effectively exfoliates and removes dead skin cells, helps stimulate the renewal of the skin, diminishes the appearance of enlarged pores, and helps lighten and even the skin tone. The salicylic acid will aid in the treatment of acne skin conditions and greatly aid in the extraction process. Salicylic acid penetrates the follicle unlike glycolic-based products and dissolves both sebum and comedones caused by problem skin. Its anti-inflammatory benefits will simultaneously aid in the treatment of post-inflammatory hyperpigmentation associated with acne lesions. This peel is self-determining and will neutralize on its own within 3 to 5 minutes. Only a single layer is placed on the face. It's important to evaluate your patient's condition to determine which peel is right for use. The experienced practitioner can use both peels simultaneously. However, this is an advanced peeling technique that is not addressed in this training video. The items used for both peels are a headband, several 4x4 cotton gauze pads, a bowl for water, a timer, a petrolatum-based product for protection in certain sensitive areas, non-latex gloves, Quintessence Skin Science Purifying Cleanser, our green tea toner, Serum C, one clarifying under-eye serum capsule, and finally, Quintessence Sunscreen. Optional items are a high-frequency unit and a small, soft facial brush. Make sure you have all your tools and products within close proximity and in the order of which they're going to be used so the peel goes smoothly and efficiently. Have your patient place the headband at their hairline. This will keep their hair off their face and away from you as well. Always maintain a clear field to work on. Make sure you fully explain the peel process to your patient and that there are no remaining questions or concerns. Fill your bowl with water and begin the cleansing process. Now, let's begin the Miami peel. To begin the Miami peel treatment protocol, double cleanse the face thoroughly with our Quintessence Skin Science Purifying Cleanser. A second cleansing may be done with a small circular facial brush in order to further exfoliate the stratum corneum. After the face is properly cleansed, degrease the skin with either toner or acetone, depending on the sensitivity level of the patient. At this point, you must allow the skin to completely dry before beginning step 3. Protect the lips, nasal labial folds, lower eyelids, and nasal openings with a petrolatum product on a cotton swab. Never dip the swab that has already been used back into the protectant. If you need to use more petrolatum product, throw the first swab away and begin with a new one. The Miami peel may be placed into a small glass dish and the cap replaced on the bottle. Make sure you're wearing latex-free gloves before you begin, and fold a 4x4 gauze pad over twice and dip it directly into the dish and cover with the solution. Gently squeeze the gauze to remove any excess liquid. Sweep the pad across the chin, jawline, cheeks, nose, forehead, and then the neck. Be cautious with the nasal labial fold, as this area may be sensitive. Firmly press, but not roughly, the gauze over the entire face and neck area. Since this is a layered peel, be sure to replace the cap between layerings as the peel may evaporate. A facial fan may be used for patient comfort level. The depth of the peel is determined by how many coats are applied. We suggest 1 coat for the first treatment in individuals with sensitive skin, and 2 coats for the initial treatment for all other patients. Each visit, the number of coats applied may slowly be increased for up to a maximum of 5 coats. A waiting time of approximately 3 minutes is necessary between coats. As an option, you may check for missed areas by using a woods lamp. The crystals will fluoresce and display a very visible bright white color, making it obvious as to which areas were missed. After the desired number of coats have been applied and are dry, apply the Quintessence Q Sunshade Sunscreen. The Miami peel is not removed. The patient leaves the peel on if possible until it's washed off the next morning with the Quintessence Skin Science Purifying Cleanser. The patient may feel a mild flaking on day 3 or 4 after the peel. However, many patients experience minimal to no peeling at all. The depth of this peel is increased by the following and should be avoided: vigorous rubbing during the application of the peel with the gauze, increased number of coats, pre-treatment with a glycolic containing peel that is neutralized prior to applying the Miami peel. Cleanse the face twice with Quintessence Skin Science Purifying Cleanser. A small facial brush or gauze may be used for the second cleansing. This will deeper exfoliate the stratum corneum before the S-30 peel begins. Allow the face to completely dry, and at this point you may test a small area of the chin or cheek for patient sensitivity level if desired to the S-30 peel. Protect the lips, nasal openings, nasolabial folds, and lower eyelids with a petrolatum-based product. This should be applied with a cotton swab. Never place a cotton swab that has already touched the patient's face into the salve again. Use the other end if further application is desired, or replace one swab with a new swab. Always protect your hands with latex-free gloves as you apply the Miami Peel S-30 directly on to a 4x4 gauze pad. Fold the gauze pad twice and apply enough of the peel to uniformly cover the face or areas to be treated. Remember to begin with the chin, then swipe the jawline, move on to the cheeks, being cautious with the nasolabial fold since that area can be quite sensitive. The Miami Peel S-30 should be applied up to the periorbital bone only and not onto the lower eyelids. Apply to the nose and finally the forehead. As an option, you may check for any missed areas with the Woods lamp. Make sure the patient's eyes are closed at all times and ask for feedback as the peel is being applied. The salicylic acid in this peel will become warmer and the client will feel it peak for approximately 3 minutes. If more peel needs to be applied, discard the used gauze pad and begin with a new one. Never leave your patient unattended during the peel process, and check to see if the area being peeled is excessively red, and remove immediately with cool water if this is the case. Always listen to patient feedback with regard to any levels of discomfort. Avoid fanning treated areas during or after the peel application, as this will diminish the efficacy of the peel by accelerating the self-neutralization product. This peel is self-determining and will shut off in approximately 3 to 5 minutes. At this point, you may remove the peel with our Quintessence Skin Purifying Cleanser and bring the pH back with our Quintessence Green Tea Toner. The toner will rehydrate the treated areas as well as make further product applications easier and smoother. If a mild microdermabrasion and or extractions are part of your skincare protocol, this would be the appropriate place for beginning this process. Wait until the Quintessence Green Tea Toner has dried before beginning this next step. Tone the skin again after extractions or microdermabrasion for a very soothing effect. Once the skin has calmed down and is still damp from the toner, apply our clarifying under-eye serum capsule. 1 capsule is enough for both lower lid areas and do not apply to the upper lids.